Fox News host Jesse Waters asked, why is measles suddenly exploding in the United States? Jessica Tarlov, the lone liberal on that show, gave him an answer. And he responded with what may be the most honest thing he has ever said on Fox, which is, I have no idea when it comes to whooping cough in the past. Now, if that's confusing, the context and the framing is what really matters. Let's take a look at this video. Then I want to talk to you about what is maybe one of the most important sort of cultural scaffoldings of MAGA right now. Take a look at this.
So the backward looking, anything that's wrong, it was Biden's fault. Sometimes it's Obama's fault. President Trump does this all the time.
So
that Fauci is, an evil guy because, he is obsessed with the flattery and he has, the time to be on the phone with these people. Donald Trump picks up the phone for anyone who calls and he'll sit on the phone with you all night. He's in the middle of a war. He can take your phone calls. The measles cases are not just a little bit up. It's over 2,370 cases, highest in 35 years. CDC has 25% less staff. 45 states, there are people with explosive diarrhea, and there is no end in sight for this. We just had our first 2 fatalities. We don't know if it's Taylor Farms. It was Taylor Farms, and it's not Taylor Farms.
Why are measles cases
Okay,
up?
then why is whooping cough back then?
I have no idea.
Because people aren't getting vaccinated anymore because you have an anti-vaxxer as the head of HHS. Women are petrified.
I haven't heard anything about the whooping cough.
Then
just
look
like
it up.
Mandela Barnes. This is news to me.
Women are petrified to take Tylenol because this administration is telling them that it's unsafe for their unborn child, that it's going to lead to a rise in autism, which is completely unfounded.
So the focus of this is incredible confidence from Jesse Waters. And then he goes, I have no idea. That really should be the motto for this entire show, for Fox News, for MAGA. But I find it particularly revealing in this particular case. If you go back to July 30, the United States already had almost 2,400 cases of confirmed measles in 2026. That's more than in all of 2025, and that was only through the end of July. 94% of the cases this year of measles are associated with outbreaks. In 2024, there were only 285 cases. This is a remarkable number associated with outbreaks, to be very clear. Measles had been declared eliminated in 2000. Now, when that happens, it's not nobody can ever bring it in again. It means that sustained domestic transmission has been stopped because we have enough vaccination. Vaccination has been falling, and MMR coverage among kindergartners in the United States went from over 95% to about 92% over just a few years. Now, you might say, well, that's a really small decline. Measles is so contagious, its reproduction rate is so high that communities need to be at 95% or more to have herd immunity. And when you look at the national number, like even 92.5% nationally, that ignores that there are parts of the country that are at 99% and parts of the country that are at 88, 89%. So you get an average of that 92.5, but you've got parts that are higher and that are lower. Once measles enters a community that's lower on the vaccination rate, it can spread very quickly. And what we do know is that 2 doses of the MMR vaccine are about 97% effective at preventing it. Jesse Waters apparently can't put any of this stuff together. It's a very simple causality. Vaccine rates go down, vaccine exemptions go up, diseases that used to be controlled by vaccines start circulating again. Well, what could have caused it? Maybe it was could it have been Hunter Biden's laptop? Could it have been what? No, it's the lack of vaccination. Now, Jessica Tarlov also brings up whooping cough, also known as pertussis. Now, there's some nuance here. Pertussis moves in cycles, and immunity from the current vaccine can decline over time. And we had a bunch of pertussis cases in late 2024. It's actually been lower so far in 26 than at the same period last year. But this broader resurgence is a very real thing. And the CDC says that more than 6 times as many pertussis cases were reported in 2024 compared to 2023. Numbers were still elevated in 25. Vaccination is the tool we have for preventing severe whooping cough. especially in babies. So I think the general point that Jessica Tarlov makes is correct, which is even if the epidemiology of pertussis is more complicated than measles, when vaccination coverage declines, preventable disease gets more of an opportunity to come back and to spread. And the same right-wing media ecosystem that spent years encouraging suspicion of vaccines, it's very dangerous. Now they sit around going, I don't know why whooping cough is back. Well, you promoted the distrust and you normalized and weaponized conspiracy theories and you treated basic public health guidance as an assault on my freedoms. And then kids start getting the diseases that we thought were under control, which were under control. And Jesse Waters, after these confident declarations, including of how horrible a person Jessica Tarlov is, he just goes, I have no idea. I don't know, Jessica. I have no idea. I have no clue. And Jessica Tarlov puts the answer right on the table. Now, it's possible. I don't want to assume. I don't know him personally. It's possible that Jesse Waters just doesn't have the courage to acknowledge any of this stuff. Maybe, I don't know, Jesse Waters lacks the capacity to understand the causality of vaccinations down, cases up. One of the things they love to do is they go, well, the COVID vaccine didn't prevent COVID, and we were lied to about that. And I have to hand it to them. I write about this extensively in my book, Pay Attention. A lot of these talking points are much stronger for the right in digital media ecosystems because it's so simple. They told us the COVID vaccine prevented COVID and it doesn't. Now, what's the truth about it? The truth is, listen, the controlled trials of the original COVID vaccine against the original strain did show that it was very good at preventing transmission. You wouldn't get COVID with that original vaccine when confronted with the original strain of the virus. Over time, the virus evolved and the vaccines were always trying to catch up. And over time, the vaccine's ability to just prevent you from getting COVID was far inferior to what that initial one was. Was it still good at preventing death? Yes. Was it still good at preventing hospitalization? Yes. Would it be great if it worked like measles, where it just prevents you from even getting the disease? Of course, that wasn't the case. But the fact that that changed over time with COVID says nothing about MMR or DTaP, pertussis, all these different vaccines that we're dealing with now. They love to mix it all together with that confident air of how dare you confront me. And then when they're asked simple questions, they go, I don't know. They don't really know. But that's never stopped them from commenting. And that is absolutely terrifying. Debt has a way of turning ordinary months into math problems that never seem to get solved. You pay what you can, you sort of like move money around, you keep up with different due dates, and the balances are sitting there and they cost more every day. Our sponsor, PDS Debt, might be able to help you. What PDS Debt does is work with people struggling with credit card, personal loans, collections, medical bills. They review your situation. They'll build a customized debt relief plan with options designed to reduce what you owe and move from juggling multiple payments to one lower monthly payment. They'll go beyond the numbers. They'll personalize the solution to your specific financial situation, not some generic formula. There's no minimum credit score required. Savings can start right when you complete the free 30-second assessment. PDS Debt is the top-rated company in the industry, thousands of five-star reviews, A+ rating from the Better Business Bureau. Lots of people in my audience use PDS Debt, and we looked at the numbers for people coming just from my show. It turns out the average David Pakman Show viewer who uses PDS Debt saves an average of $24,994. Get your free 30-second personalized assessment today at pdsdebt.com/PakmanYT. The link is in the description.